my name is Rebecca Irwin and I'm currently based at Barcaldine, and my role is Provisional Fellow Senior Medical Officer. I was set on becoming a rural generalist from my med student days. I was already heavily involved with the Rural Health Club and something called the National Rural Health Student Network, and so I'd already experienced my third year on rural placement and decided this was the career for me. So about 6 months prior to the job, I met everyone. They were a wonderful team and unit, and they'd been there for a couple of years already, so there was a nice stable network. The fact that I would be a rural generalist based primarily at a GP practice in Barcaldine, but then working across the hospital, doing outreach to other communities, doing a little bit of ED, so just doing a little bit of everything. It was kind of my dream job, essentially. We came here thinking we might spend a couple of years here as a family, and within 3 or 4 months we looked at each other, my husband and I, went, we really like it here, don't we? We're like, yeah, we're going to stay here, aren't we? Yep. And so we bought land, and now we're planning on building and staying, and our kids love the daycare here. We're planning for schooling next year, and we're just really, really happy, to be honest. It's a beautiful community. One of the things that some of my friends are concerned about when they think about moving remote is about a lack of opportunities when you move rural and remote. I would say it's the complete opposite. We work in a really tight-knit team, so when the rare emergencies do occur, you are involved, you are an essential member of that team, and I have done skills that I would not have done if I was in a metropolitan area, but in a supported and calm actually environment, which is wonderful. And in terms of opportunities for education, I'm really, really lucky that where I am in Barcaldine, we've got a solid base of permanent doctors, and it also means that I'm allowed as part of that job to have professional development leave. So I have opportunities to educate locally. So we have the Royal Flying Doctor Service, who actually comes out and runs rural emergency training opportunities, as well as being supported to go out of the town to be able to do extra educations. We really, really love the community feel, and there's a lot of other young families in town, so that's been a really big factor for us, is that we now have friends with similar age kids that we hang out with weekends. We've got a support network around us because we are far away from our other family units, but it's worked out really, really well for us, and we're really, really happy here too. It's a perfect time to move remote if you have a family, if you have a partner setting up that family. It's a fantastic opportunity to be involved in the community, and there's so much that you can offer and so much the community can offer you.